At our hospitals across CHI, clinical and process excellence, or CPE, is the way we will transform patient care to provide excellent quality while reducing cost.
We're getting paid now for outcomes, and so we need to improve outcomes, looking at readmission rates, quality of care, healthcare, acquired infections, all those things. This will help address, because through standardization of processes, you're less likely to make errors and so forth. The second issue is financial. I mean, we absolutely have to eliminate waste. In order to survive in the new marketplace, we can't have waste. And we do have waste in the system now, and I think this is a great way to address it and eliminate it.
CPE is a springboard for a new, improved way of delivering patient care. This journey begins with an 18-week process that focuses primarily on 3 workflow areas: the emergency department, inpatient units, and the operating room, including the procedure labs. Teams of frontline nurses, clinicians, physicians, and staff, those who are closest to our patients, work together at each hospital. Each team designs new processes and workflows based on best practices, clinical evidence, and standardization. About halfway through this work, in an interactive setting we call the gallery walk, teams informally present their work to hospital leaders. They share the data they've gathered, as well as their identified areas of opportunity, proposed solutions, and potential results. Next, the hospitals pilot the solutions. At the end of the 18-week period, teams share the outcome of their pilot projects in another gallery walk, as well as the results they expect when the solutions are fully implemented. From there, the solutions are monitored and improved as needed. We're excited about the positive energy the CPE project generated at St. Elizabeth in Lincoln, one of the first hospitals to launch CPE, along with Mercy in Des Moines.
A couple of things that I'm most excited about. First of all, as I'm looking at the goal of patient care, which is what hospitals are all about, I'm looking at some of the throughput issues that the teams are working on and the ability to actually improve wait times for patients and improve our ability to get patients admitted in a timely manner, get them discharged in a timely manner, and not ask them redundant questions throughout their stay. I think hospitals are known for doing that. So from a patient perspective, I'm really excited about that work. And then from a financial perspective, one of the things I'm excited about is the work that our emergency department team is doing to improve the collections of patients with their copays as they come into the emergency department. I think that's going to have some immediate financial effects on the organization.
As you can see by this graph, what it's telling us is these blue lines are how many collections are collected from month to month throughout the year, and the purple line is how many patients we've had. So as you can see that our patient level stays pretty consistent, but our point of service collections are very variable. So we hope to improve that process and make it more consistent.
In the ED, point of service collections are already 5 times higher than they were before this work, thanks to the changes that the ED team developed. Lincoln's inpatient team found ways to shorten the length of stay for some observation patients by 8 hours and expects an even greater improvement in the future.
Currently, we're treating the observation patients identically to their inpatient counterparts, despite their differing needs. So some benefits of reducing the observation patient length of stay, we've kind of discussed reducing their out-of-pocket costs. The longer they're here, the more costs associated with that. And reducing the wait times by moving them to a priority. Also for the providers, aligning the physician capacity to the patient care needs and improving the flow so that they are prioritizing the patients. And for staff members to improve the alignment of the resources and the capacity to the care needs, as well as streamlining the process.
Certainly we want our physicians, our surgeons to have the right equipment at the right time, and we don't want staff to be processing things that are not needed, but yet when the trays come up to the OR, we want the surgeons to have the right equipment to do their job so there's no delays. It helps us have better start times. That sets the pace for the whole operating room experience for the whole day.
Each hospital will launch CPE using a similar 18-week process. By the end of 2014, all CHI hospitals will have completed this initial stage. Each step of the way, results will be shared across CHI, and the very best local ideas will be amplified for a national rollout. and we are confident that every facility will come up with the best idea to share.
It's been staff, grassroots effort, but I think administration has been very supportive. The teams have come for every week for an hour to apprise the administrative team and our CEO of what's transpiring, what the plans are, implications of the plans. The physicians have been actively involved.
So I think the two of them working together, the teams of physicians and nurses, have been most effective. And particularly what's helped us a lot is having our hospitalists involved, having physicians who are in-house 24/7, who understand the flow better, who have a relationship that's better with nurses than most other physicians may have. That sort of teamwork has led to, I think, a lot more progress.
I'm on the floor and I'm so excited to see this happen. And a great example is I pulled 2 more nurses from short stay into a small solution meeting yesterday, and we know we're going to have some feathers ruffled, and it's going to be difficult because change is difficult. But those 2, just by meeting and learning about what we're going to do, we're just so excited, and we're talking about it, and you're going to implement it better if it's our ideas.
CPE will benefit our patients, our employees, our medical staff, our hospitals, and CHI as a whole. For our patients, it is always better to get higher quality at a lower cost. For our employees and our physicians, it's an opportunity to take part in changing healthcare in America for the better. For our hospitals and for CHI, it's an opportunity to carry forward the mission that our sisters have left with us into the future, because we will be able to afford what we're going to need to move into the next era.